Is mold making you sick? Could it be the cause of your mystery autoimmune disease? Well, it was for me, and some experts estimate that 20% of the population could be struggling with mold toxicity and not even realize it. I recently figured out that mold was the cause of my chronic illness that I've been struggling with for the past 4 years, and I'm currently on an extensive treatment plan to get better. If you're new here, I have a degree in science and I enjoy doing research on topics and reporting them.
Planet Near Podcast. This is the journey of setting yourself free.
Symptoms. Okay, as mentioned above, symptoms can be multi-system and multi-symptom. So mold illness can be hard to diagnose because two people living in the same house can have completely different symptoms, making it really difficult to pinpoint mold. And this is more exacerbated when one person has the gene and the other doesn't, because one person may be getting chronically sick while the other person only gets a blocked sinus. So this causes them to rule out environment. The following is the list of symptoms commonly experienced with mold toxicity and is taken from Dr. Jill Krista's book, Break the Mold. So as you will see, there are a lot, and each symptom from each category is worth different points that tell you to give you an indication if mold toxicity is your problem. It's quite detailed, so for more information, I really recommend just going to her website, which I have put on my blog. So category 1, brain fog, feeling tired all the time, frequent runny nose, blowing your nose often, sneezing, sinusitis, postnasal drip, nosebleeds, swollen glands, shortness of breath, frequent yawning or sighing, heart palpitations, headaches, hay fever, eye irritation, blurry vision, frequent changes in vision, allergies, dark circles under eyes, sensitivity to sunlight, nervousness/can't settle down, low mood or depressed, feeling overwhelmed, episodic/chronic dry cough, irritated lungs, blood-streaked mucus, nasal polyps, coated tongue, sores in the mouth, bumps on the back of the throat, thrush, sore or itchy ear canals, ringing in the ears, bothered by loud noises, skin rash, burning or itchy skin, easy bruising, spider veins, bothered by tags and seams on clothing, anemia, protruding veins on limbs, lower extremity edema, clear your throat often, sore throat, frequent colds, delayed recovery from colds, exhausted from exercise, frequent static shocks, increased thirst, trouble sleeping, feeling of internal vibration, dizziness, vertigo, drunken feeling, frequent urination, yeast infection, changes in appetite, intestinal gas, nausea, feeling bloated, constipation, crave sweets, crave alcohol. So yeah, that's a lot. And as you can see, a lot of my really random but specific symptoms like itchy ear canals, it all makes sense. Okay, so category 2, wheezing, asthma, burnt lungs, recurrent respiratory infections, migraine, allergies that aren't well controlled by medication, voice sounds nasally, plugged or clogged ears, chronic sinusitis, vomiting, alternating constipation/diarrhea, diarrhea, irritable bowel, food sensitivities, chemical sensitivities, abnormal reaction to antibiotics, Epstein-Barr virus, recurrent yeast infections, bacterial vaginosis, recurrent athlete's foot, jock itch, or toenail fungus, peeling/slouching skin, episodes of fast heart rate, chest pain, Raynaud's syndrome, non-obstructive sleep apnea, difficulty thinking clearly, disorientation, balance issues, slow reflexes, incoordination, numbness or tingling, nerve pains, unexplained menstrual changes, overactive bladder, bladder infection, react to musty spaces. Category 3 has a lot of conditions that I honestly can't pronounce. So check out her website or my blog, but I'm also dyslexic. Remember the autism, so I'm doing my best. So daily use of sinus spray, sinus prescription or neti pot, sinus surgery at any time in your life, chronic inflammation response syndrome or CIRS, MARCONS, peanut allergy, chronic fatigue syndrome, difficulty walking, POTS, PANS, hearing loss, confusion, dementia, memory loss, tremors, sarcoidosis, asthma that's difficult to control with medication, idiopathic pneumonitis, lung scarring or nodules, respiratory distress, histamine intolerance, ulcer, non-celiac intestinal disease, blood in stool, cyclic vomiting syndrome, liver pain or swelling, fatty liver, NASH, kidney pain or swelling, kidney disease, chronic pelvic pain, infertility, previous or current cancer diagnosis, mast cell activation syndrome, exposure to water-damaged buildings at any time in your life, exposure to mould, or a positive shoemaker test. I'm also going to go into SEERS below, and there's certain symptoms that are specifically associated with SEERS, particularly in categories or clusters.